Morning, everyone. I am indeed very happy to be here, and I would like to thank Dr. Gunasingh for giving me this opportunity. Um, Many of my friends are here, so they will be knowing how I was some 3 or 4 months back. So that is how the things have come into my mind, and this is not the first time I tried to reduce my weight, and I have done somewhat successfully previously, but this time this will stay for my life. That is mainly I want to give that credit to the intermittent fasting. First, my topic is on intermittent fasting and diabetes. As sir clearly told, there are not much studies to support, and there is a myth that intermittent fasting should not be done for diabetics like that. But we need data to say that. Okay, that is the only thing that is not present nowadays. But still, if you search in the Google and search in the search engine of many studies, still we are able to find many studies that support intermittent fasting and calorie restriction. We'll go one by one. So, what is the problem in Indian diet? What is keto diet and intermittent fasting, and challenges with the keto diet and benefits of intermittent fasting? See how Indian diet changes over the time. Our tradition is not to take unhealthy foods. That is the basics of Indians. And suddenly there is increase in the population and food scarcity. And scarcity, food famine acted as a source of intermittent fasting for those people who lived in that era. But then came the Green Revolution. Then they started taking agriculture into an industry. This started increasing the wheat and rice production, and this now the Indian foods contain the refined carbohydrates that replaced the complex carbohydrates which we had previously, which our grandfather and parents had previously. And the carboholic Indians, you can see whether it is a diabetic group or non-diabetic group, most of the people, most of the Indians thrive on the carbohydrates, and it goes up to 70%, 67%, 63%. And here all parts of India is united. There is no diversity at all, whether it is a diabetic or non-diabetic. So all are relying more on the carbohydrates. So around 65 to 70% of our daily energy comes from carbohydrate. 7 out of 10 diabetics follow imbalanced carbohydrate diet. And how India eats. See, this is during COVID time. Now you can see everywhere, every movie that collected 200 crores, now 600 crores, like that. So this also would have gone up very fast. Okay, so you can see a lot of Domino's, Pizzas, McDonald's, and average sales per each shop. Okay, it's better you can buy shares of those companies, but we should not. We should stop going to those shops. And here we can say previously this type of shops, these type of unhealthy foods are available only in the tier 1 cities. I am practicing in Melmaruvathur, which is not a big town. And just before my clinic, even in their advertisement, opposite to Dr.Appanraj clinic, they have given, and everything is there. You can have momos, you can have all unhealthy foods, you can have all types of sandwiches and everything, cheese, creams, and everything looks like atiroma for me. So that is available in each and every village, and you can see a lot of common people who go and eat there, and they are not mind spending money for that. So availability of too much of food, and since we are the only animal who even eat during our fed state, so that is the problem that is happening for most of the non-communicable diseases. So the culprit for obesity and diabetes is mainly the carbohydrates, obesity and diabetes. See, this is the idea of criteria for metabolic syndrome, and many will be knowing that. So in India, greater than 90 centimeter for male and greater than 80 centimeter for female. If you take, most of us would have been having the abdominal obesity. Triglycerides So greater than 150 and HDL less than 40 and less than 50 and blood pressure. So this is the criteria. See, if you take this as a criteria, we have more and more number of people who are suffering from metabolic syndrome in India. I will just go into that because we have the study ICM or INDIAB study. Diabesity in India, the diabetes people are obese. Diabesity is the problem, and 38% of the diabetes are overweight in India. And take it from me, most of the people are maintaining their BMI because of the poor control of diabetes. So especially in the rural areas, so their weight has come down, but still because of the unhealthy eating pattern, they are not able to maintain their blood sugar level as well as their BMI. It's coming down. And waist circumference plays a major role. This is the point where we all know BMI, more than BMI, the waist circumference plays a major role in the metabolic syndrome. And our intermittent fasting reduces your abdominal obesity more than your BMI, and that is their welcome sign. And reducing carbs, even just slightly, can reverse the diabetes. So diabetes reversal remission is going on talk for a longer period of time. But I have been practicing in a rural area, but with my guide to the patients. I will guide the patients for almost 30 minutes. First time if they come, at least 30 minutes. I will tell what happens to their beta cells, how they are going to kill the remaining beta cells, everything I will tell them in the way they will understand. And I am very proud to say 80 to 90% of my patients who are diagnosed with the newly detected type 2 DM will be out of drugs. Whether they come with a HbA1c 11 or 10 or 9, that doesn't matter. So they will be out of drugs within 6 months. Okay. But they will come to me after some days or some months, some years with again diabetes. So only problem what I did previously is I used to tell them. So once they are out of drugs, I used to write. So this is your fasting value. This is your postprandial value. If it is more than that, then only come to me. You check every monthly yourself. But these people are not doing that. And even though I am warning them, you are not non-diabetic. You are diabetic for your lifetime. You are controlling with your food pattern. But they are not doing it for a continuous time and they will land up. So now I started. Now I told them, whether you are taking drugs or not, you should come once in 3 months and you have to check your HbA1c. So that is how I am trying to keep their momentum, and I will be very happy. And I have a patient who had HbA1c 12.8 in 2014, still not on any drugs. And yesterday also, a female brought her husband for the first time diabetics, and she has been treated by me, counseled by me almost 7 years back, and still she is maintaining her fasting and postprandial blood sugars are 88 and 121 yesterday also. So I was very happy to see those patients who are maintaining. So this is the real scenario, upcoming tsunami. Okay. See, INDIAB study by ICMR has proven almost diabetes are 101 million. So we crossed 101 million. So, and again, there is another 351.1 people are hypertension. Sir told, you just check your food, what we are eating, packaged foods. Even a 20 rupees Lay's pocket will give you the recommended daily allowance of sodium almost 40 to 50%. If you take 2 Lays, because you can't stop with one, so that's finished. Your entire dietary allowance for sodium has been finished. So why can't you land up with hypertension? And much more to come, because you can see another 236 million people are having dysglycemia and abdominal obesity 351.1 million. All these people will land up as diabetes or metabolic syndrome, and these peoples are going to have the cardiovascular risk factors, and it is high time that government should wake up, and already they are doing their level best. They are announcing millet year with UNESCO and everything they are doing. But only thing, we have to adapt. So the estimated number of type 2 diabetes is almost 100 million, more than 100 million. And you can expect in another 20, 30 years, it is going to be 400 to 500 millions. And how we are going to cope up with that? So definitely we will cope up, but still it's a high time that we have to do that. And you can see there is wide variation between the states. Tamil Nadu, Kerala, which are more relying on the rice, they are having more diabetics. So the diet option for intermittent, diabetics, intermittent fasting diet. If you really ask me, so whether you are following intermittent fasting in diabetic patients, I will say definitely no. I am not doing that. Okay. From the beginning, I was against the diet pattern of diabetics that has been told by a lot of doctors. You eat 5 to 6 times, 7 times, 8 times. So eating is not our profession. We can't do that continuously. So it is just a thing. So I will always ask them to take only 3 meals per day, and with carbohydrate restriction and total refined sugar restriction. So that gave the success for my patients, because I myself has been introduced to the intermittent fasting just 5 months back. Okay, I was following for just 5 months back. I am kid, and even I don't know much of the basics of the intermittent fasting, truly, but I have been benefited by that. But my patients have been benefited by just carbohydrate restriction itself. So the diet option is intermittent fasting, and 8 hours feeding and 16 hours fasting. And you can, for diabetics, as I told, you can keep 12 hours fasting or 14 hours fasting. That is more than enough. So you are not taking anything for 14 hours itself will be a good thing. Now what we are doing? We are doing a bakri eating, like goat eating all the time. So we are going, opening the fridge, taking something and eating. We are going to shop. So I used to break at least 3 times during my clinic, from 2:30 to 9:30. I will take 3 coffees, and I have the habit of taking coffee and seeing patients. I have the habit of taking sandwich and seeing patients. So that was my routine. So I won't stop for that also. And morning time and all, I won't take much. Afternoon, I used to take some food, that also mainly fruits. But every day we will be having meeting with our managing director or medical director. So there, some samosas, puffs, juice, something, unhealthy foods. Again with the PG meeting, again we used to take. And some reason we will take from opposite shop, some samosas, puffs, like that. And night I will go. That is the worst part that I have done. Okay, so what we will do is, I will see TV for 30-40 minutes, and I will finish off what and all kept. Okay, so that is the thing I did some 5 months back. So whether we have any evidences, so that has been asked. So yes, we have a lot of evidences. Even in your Medscape, there are a lot of evidences to say intermittent fasting plus yearly eating prevent type 2 diabetes. And intermittent fasting style may put diabetes in remission. Can intermittent fasting reverse diabetes? Definitely it can do. Intermittent fasting, how effective it is in reducing the glucose levels. Intermittent fasting improves weight loss in adults. Type 2 diabetes and weight loss, intermittent fasting is the best option. And we have studies also to show how much HbA1c has been reduced, triglycerides reduced, LDL reduced, everything. So intermittent fasting is a diet pattern that cycles between the period of fasting and eating on a regular schedule, and mainly intermittent energy restriction and time restricted fasting. And here we will be following only the time restricted fasting, and it provides the permanent control. It is a age-old tradition, as I told. It is not a new thing. Okay. So now going to the basics almost reverses most of the diseases. So what has been done in the previous time, we think they are fools, they are not done. But now we are just switching to the basics. So this has been followed by since the ancient time, and religion and fasting. See, almost every religion has practiced at least for some time during entire year an intermittent fasting. I am I belong to Jainism, and there we should take our last meal before 6 p.m. and we should not take before seeing the sun. So it itself an intermittent fasting. Without knowing the science behind that, I used to ridicule my parents. Why like that? That time insects would have been there, lights are not there, so insects would have died. That's why Mahavir would have told like that. But now only I'm understanding those time people are more clever and more healthier than us. And now we are just switching to the basics. And Ramadan fasting, and again, so they will come to us for diabetes control. So we will easily switch over the drugs, and we can see they are not taking foods for 14 to 15 months. And you can see many people are reducing their weight in spite of their feasting during their Ramadan period. So they will take all non-veg, but in spite of that, within that 1 month, that time their sugar will be very good control, even though we are reducing their drugs by 20%. That is what we are seeing in the patients. And intermittent fasting it's not compulsion, it's a choice. We have to take intermittent fasting. When to eat matters, that has been already told by sir, but in diabetics it is only time restricted eating. So all other things are not fit for diabetic patients, and intermittent fasting, time restricted eating only. And as of now, we have studies only for 12 hours fasting. Okay, so 12 hours fasting is usual thing that has been done. We are only taking foods in the night time. Nowadays only it has been increased. So the already sir told about chrononutrition, several biological processes related to the metabolism, digestion, and hormone secretion possess the circadian rhythms. So stick on to the basics and eat at exact time. That itself will reduce the complications because of the chrononutrition. So the time of day dependent patterns of circulating hormones, you can see the ghrelin is secreted 8 a.m., 1 p.m. and 6 p.m. and it is not being secreted after that. So better to stop foods before 6 p.m. And this is how we have to go and synchronize. When we synchronize factors affecting the circadian clock rhythm, so the chrononutrition, when the synchronize occurs, there is a good metabolic health outcomes. So when it is not synchronizing, we are going to land up with the type 2 DM, poor glucose control, and obesity. And these are the basics. That is why when we switch to the basics, avoiding unnecessary calories and unwanted foods, almost many patients of diabetics, because whatever we say, many patients will not follow. Only 50% they will follow. Even with that 50%, they are able to control their sugar within 3 to 6 months. Means definitely there is lot of things that what we eat matters. So night day shifts, jet lag, late night eating, and meal skipping, and food habits not taking into account for the daily metabolic hormones, all this leads to the disruption of circadian clocks and leads to obesity, diabetic risk, and cardiovascular risk. And just switching to the basics, time restricted eating, 8 a.m. to 4 p.m. or even 8 a.m. to 6 p.m. good. It acts synchronizingly with the ghrelin, adiponectin, and insulin and leptin oscillations, and there is an alignment, and this decreases the obesity, diabetic risk, and especially the cardiovascular risk. Intermittent fasting and circadian rhythm, when it gets along better, it definitely reduces the inflammation and increases the insulin sensitivity and keep calm the satiety hormones, and thereby reducing the obesity, type 2 DM, CVD, and cancer. And already speakers have told about how it increases the human growth hormone, and insulin sensitivity has been proven beyond doubt in the intermittent fasting, and cellular repair, that is autophagy, that has been already told by the previous speakers, and gene expression. This leads to the longevity and protection. Whoever want to live longer should go for intermittent fasting. There is no other option for you. If you want to live longer, you have to go for intermittent fasting. Okay. If you are obese, definitely life is almost 60, 65. when any that is what. So that only made my mind at the age of 44 to 45. So I should reduce my weight at least. Okay, and there are many additional benefits what we have when we reduce our weight. This is the effect of intermittent fasting diet on glucose and lipid metabolism. You can see it is having a positive effect on the glucose reduction. HbA1c also significantly reduced with the intermittent fasting, and also the insulin resistance have come down. Insulin sensitivity has been increased, and it has been proven beyond doubt by many studies, not one study. It has been a series of studies. It has proven beyond doubt that intermittent fasting has reduced fasting blood glucose, HbA1c, HOMA-IR, and even my insulin. Actually, I'm not a diabetic, I'm not an hypertensive. I was just obese, okay, probably fitting into metabolic syndrome. Before starting that, my fasting insulin, though it is within the normal, it was 21. Within 3 months of this intermittent fasting, it came down to 10, 10.5. And now I have to see it will come much more down after 2 months, another 2 months. And body weight definitely have a positive effect because of the intermittent fasting. And waist circumference is the area where intermittent fasting plays a major role. And you can see the lipid profiles. Many people will discourage you that your triglycerides may go up with the keto diet and intermittent fasting like that. But studies have proven even the triglycerides has been reduced. But there are some studies to say when it is very much time restricted, less than 6 hours of fasting, triglycerides may go up. Okay. So it has reduction in the total cholesterol, increase in the HDL, and decrease in the LDL have been noted. All positive benefits on the lipid profile. And a systematic review and meta-analysis of effect of intermittent fasting and glucose lipid has shown it have the therapeutic effects on the blood glucose and lipids, and in patients with the metabolic syndrome, and definitely increases the insulin resistance. At this point of time, there are only 100 million diabetics, but we have another 300 to 400 million people who can land up with the diabetes. So first, as those people, whoever walk to your clinic, if their BMI is high, straight away prescribe intermittent fasting. So we will have studies. We are doing studies. So definitely we will have enough study within few months or few years that intermittent fasting do wonder even in diabetics. So excellent studies will come. So different types of intermittent fasting reduce body weight and reduce diabetes parameters, fasting glucose, fasting insulin, insulin resistance index, and also the glycated hemoglobin. So it was more beneficial in reducing your body weight, so which plays a major role for most of the cardiovascular thing, and fat mass without affecting the lean mass, and also improves the insulin resistance and blood lipid to the non-intervention diets. So there is 5 to 10% decrease in the CVD risk factors, but it is definitely underestimated. Definitely it will be more if it has been practiced correctly. And weight loss by 10 to 15%. I already almost lost 20% weight, 20% weight, 25% weight almost. Key points about intermittent fasting: it should be medically supervised. Therapeutic fasting regimens can help the type 2 diabetes. So that has been done in my patients, and I have a lot of data. Therapeutic fasting is an underutilized dietary intervention. Fasting is a practical dietary strategy. With the proper education and support, we found compliance to be good. This has been published in the BMG. So take home messages: it reduces weight, reduces your waist circumference more than your weight, it decreases your insulin resistance, it improves your cellular metabolism, it decreases the lipid levels, and it decreases your HbA1c. Just 1% reduction in your HbA1c can reduce your microvascular complications by almost 47%. and your macrovascular complications by 20 to 25%. So that much reduction can be done. And if proper study has been taken, intermittent fasting itself will reduce almost 1%, even if you are allowing them to take food. And if you restrict direct sugar 100%, it will be more than 2 to 3%. That's how my patients who are on 11, 12 are now maintaining at 5.8 and 6.2. And it improves the circadian cycle and decreases the CVD risk factors. So decreases the burden of diabetes mellitus and future cardiovascular risk factors. So with that, I finish diabetes, and I'll go for my weight loss journey. Okay. So I already declared I'm not a diabetic, I'm not an hypertensive. Only thing is I was obese, and I have a lot of reasons to stay obese. So a lot of stress, father, health, like that. I used to say. So association, but there is a time that we have to look into us, okay, and we have to be healthy in order to carry out all the work that has been done, that has been laid down for the past 20 years. So for that, the best way and successful method, and easily it can be done in a very shorter period of time, is intermittent fasting. I have tried calorie restriction during my father was admitted in 2016. He was hospitalized for 100 days. After that, I gained much weight, and after he recovered, so I tried calorie restriction and exercise, and I reduced almost 14 kgs. From 87, I went to 74. And after that, slightly, whenever we start taking food just with calorie restriction, naturally, once you break, it will break and you will gain weight. And I already gave a lot of excuses. So I again gained weight. COVID, we took care of entire COVID patients during our hospital. So I built one hospital. So like that, a lot of things has been done in the past few years. I conducted one state level conference, physicians conference in Tamil Nadu, mid-Tapicon 2022. So all these excuses I have given for taking a lot of foods and increasing my weight. My wife used to say, kindly reduce your weight, you have to take care of your health, like that. But I never used to listen. I used to say, I have a lot of stress. Okay, like that I used to go. This is my picture that has been taken on May 13th when I visited Goa for a conference, and this has been taken during my speech in GCDC that has been held in September. So the difference in weight is almost 20 kg during that time. So this has been taken in May 13, and this is in September 23-24. Okay. So one day. So my profile on 27th May. Okay. To honestly say, on 25th of May, I used to go for conferences, for speech and other things. 25th, suddenly one day, she used to ask, reduce your weight, like that. But I never concentrate. So after this Goa tour and our tour, in between that 13 to 23, one day my wife started crying. You are not taking care of your health. She's also a doctor. She's a pediatrician. She also knows nursing and Krishna. So okay, then I thought, okay, so this time I should reduce weight and I should not revert back. So what I have to do? Then I started reading. My friend Prasanna introduced intermittent fasting. So I started reading little bit with the time available for me. Then I thought, okay, so I will advocate this. So in order to be a role model, so I want to do a reduction in a healthier way, but also in a faster way. See, when you try to say, I'm going to reduce my weight. So when you are obese, so there will be a lot of nannies. Okay, you can't reduce. It is very difficult. நம்ம ப்ரொஃபஷனில் அது முடியாது, நீங்க இவ்வளோ நேரம் ப்ராக்டிஸ் பண்றீங்க. ஸோ இந்த மாதிரி எதுவுமே. ஸோ but definitely we can do by spending very shorter period of time. If this reduction, I took only 45 minutes for exercise in the past 5 months, and nowadays even I have reduced it to 30 minutes for after August 31st. and only calorie count and intermittent fasting. These three only has reduced my weight in a healthier way. All my reports have become normal. So only 2, 3 I have abnormalities. One is vitamin D that I have taken drug and corrected, and remaining thing is my BMI. You can see my BMI was 33.98 when I started. So 27th May and 31st May I started diet and walking. So from 31st May till now, my iPhone ring was closed on all days. Before that, only few days my ring will be closed. I have set very less only, 270 calories only. But for 270 calories, I just 4 kilometers walking was enough at that time. But now I have to do at least 7.5 kilometers after I reduce my weight. So that's what my iPhone says. So my weight was reduced from 92.5 to 70.5. Gunasingh sir has put 25 kgs. I tried my level best to reduce 25 kgs before this set of point, but I was not able to do. But I was really sorry for that. But my target of 65 is only during my February, but hope I can achieve it before this December. And my waist circumference was 110 and it is now 87. Okay. And exercise, previously I said I never used to exercise. மார்னிங் வந்து காஃபி கொடுத்து தான் ஒய்ஃப் எழுப்பணும். நான் எந்திரிச்சிட்டு குளிச்சுட்டு அப்படியே வந்து கொஞ்ச நேரத்தில் சனுக்கு மட்டும் ஊட்டிட்டு ஐ வில் கோ. அவனை கூட்டும் போது அப்படியே லைட்டாக சாப்பிட்டு அப்படியே கார் எடுத்துட்டு we used to go to Melmaruvathur. There it will be busy till 2:30. So all things funda I have taken, and after that, after 2:30, I go to clinic. From there, again 2 or 3 breaks for coffee. That's what my lifestyle before, and I never exercise and TV and all other things. But now I stopped watching TVs. I stopped watching debates. There has been a study conducted. So while watching the debates in TVs, your BP rises by 7 to 8 millimeter at least. Definitely, it's not joke. Definitely, those people will make a lot of noise. At the end, if you see what was the point you get from that, it's totally lost. My screen time with the phone, though I used to do shares and other things, it was 5 hours before. I myself wonder. So I'm practicing for this much of time, but still I'm seeing phone for this much of time like that. But now it is less than 1 hour. Okay, including my talks and all other things. So including my reading. Okay, so it was just 1 hour or less than that. I try to keep it 30 minutes or less, but it is a long time to go. I was not able to reduce it. So this is my May 23rd photo, and this is my July 5th. See, within 40 days, my May 31st, I started dieting and exercising. Within 40 days, I reduced to 12 kg. So that gave me a very good boost. So how it started is from May 31st, I decided, okay. So from the beginning, I wanted to take intermittent fasting and I wanted to take OMAD from the first day. So I read the pros and cons, but I want to take OMAD. For any good thing to happen, first 15 days will be difficult. So I want to overcome that. Sir may say that is not right, but for the first 15 days, I used thin buttermilk. And thin buttermilk. They used to give 2 liters for me. Okay, 2 liters, and that is summer season, no? So tender coconut. These two, I was taking lot during that time. So PGs கிட்ட காலையில பேசும்போது பயிர் ஒரு மாதிரி இருக்கும். போய் அந்த மினி கிளினிக்கல் எக்ஸாமினேஷன்லயே அப்படியே மோர் எடுத்து குடிச்சிக்கிட்டே இருப்பேன். Now we are taking buttermilk, but we are not taking it at all. Only during our lunch period we touch that bottle itself. So that came within 20 days. After 20 days, I never touched the buttermilk during any of the time, except for my lunch period. And my success came from May 31st to August 31st, I was practicing OMAD, full-time OMAD, only one meal a day. And now I am taking 1.5 meals a day because now I was not able to take much during my lunchtime. So I want to take little amount of protein. So I am taking it on 6 p.m. Okay, during my clinic time, I used to take only nuts or something proteins, some groundnuts or something like that. So walking at least for 40 minutes. So initially I tried to do 50 minutes, 5 kilometer walking. And now with my weight has been reduced, God has given me enough strength to go for a jogging, which I am finishing the 5 kilometers now in 38 minutes or 37 minutes. So that 13 minutes reduction has been given by because of this weight reduction. And previously, I always used to take lift during now only ramps or staircase. Stopped sugar and sugar related items. Totally, I boycotted. So though I am not diabetic, I totally removed all. So any source of sugar only came from fruits or vegetables. And stopped milk. I didn't touch milk for past 5 months except for few occasions. See, my thing is we should not go back into that. So 1 or 2 times we can cheat. So that's my intention. So what I do is, so I totally not taking, but any situation comes, any management people ask me to take like that. So I won't say anything. I will just take. So in the past 150 days, I took 10 coffees. That's the milk coffees, and probably maybe with the sugar. And stopped packed foods. None of the foods which has been added preservatives I didn't take. For past 5 months, I didn't take anything. And I stopped buck eating. Previously, I used coffee 3 times. Sir told humans used to take lot of things. So that I totally stopped. I stopped buck eating. So I am opening my mouth only 2 times. Now, previously only 1 time for eating purpose. Other times, it is only a non-caloric water, black tea or black coffee. So that is the thing that gave me this success. So stopped rice, totally stopped rice. So again, whenever I go to marriage or any occasion where they serve only this, I used to take very little with a lot of vegetables. So that is the thing. And I would have cheated almost 4 or 5 times in the past 5 months. And not in within first month, I never did. And stopped rice. And there is something called HealthCon lifestyle regimen that has been done by Dr. Ram Gudke. He is from Mumbai. He is a radiologist. He is running WealthCon and HealthCon. WealthCon is for making wealth, and HealthCon is to keep doctors fit. So many of us are teaching the patients, but we are not following the healthy lifestyle regimen. So he started HealthCon lifestyle regimen, and I have a goal setting for each and every time. So before my talks, so in mid Tapicon, I was 91 kg. So I want to reduce my weight before Tapicon speech, 75 like that. So before this GCDC, I want to keep as 74, 73 like that. And now I want to keep before this meeting less than 70, but I failed. I failed in almost all the things, but I used to keep setting such a higher manner. So I will fail when a whisker. So I never succeeded, but I want to do that purposefully. And now it is 70.5. Definitely, I will reduce in another 1 or 2 days. Okay. So goal setting has been done. And my food pattern is not only protein diet or only fat diet. Okay, not keto diet like that. So what has been followed previously by our ancient peoples? Carbohydrates 50%, protein 30%, and fat 20%. 5:3:2 ratio. And this carbohydrates is mainly the complex carbohydrates. Almost among the carbohydrates, 60% comes from fruits and vegetables. Only 20 to 30% comes from the millets. And proteins, being a vegetarian like sir, I used to rely mostly on soya, tofu, paneer, and previously, as I told, I don't like the taste much, but now just taking paneer from fridge and taking just like that gives the enormous taste. So previously, this groundnuts and all will not be looking tasty for me. But yesterday, I had only one 100 grams of groundnut. That is the only food I had yesterday, because I want to come down to 70 at least today. But again, I failed. I was in 70.5. So that is the only thing I had except for water and black coffee. And I'm very active. I finished my um, goal yesterday also in iPhone. And only black coffee or thin buttermilk at other times. So, and now I am taking off meal in the evening. Before there is big zero, but now I am doing at least for 30 minutes, and again another 30 minutes during my hospital. I used to go always with the RAMs. So my motivators, I want to thank Dr. Prasanna. I want to thank Dr. Gunasingh, who introduced me to this group, and I was very happy that he invited me to give a talk. And my mentor, Dr. Ram, who created HealthCon regimen. Okay, and it is very easy for everyone to follow. For me, I was obese. I took OMAD, but for others, it will be very easy. This regimen I will show you now, and my wife Shivagama Sundari, who helped me, and I again telling that switching to the basics. See, this OMAD is there in Hinduism for a longer period of time. ஏதோ ஒரு காரணம் சொல்லி நம்ம லேடிஸ் ப்ரீவியஸ்ல அம்மாலாம் பார்த்துருப்பீங்க, பாட்டிலாம் பார்த்துருப்பீங்க. ஏதாவது ஒரு காரணம் சொல்லுவாங்க. சஷ்டின்னு சொல்லுவாங்க, இது சதுர்த்தின்னு சொல்லுவாங்க, வெள்ளிக்கிழமைன்னு சொல்லுவாங்க, செவ்வாய்க்கிழமைன்னு சொல்லுவாங்க. ஒரு பொழுது மட்டும்தான் சாப்பிடுவாங்க. ஸோ தட் இட் செல்ஃப் வில் ஹெல்ப் யூ. ஹவ் இட் ஹெல்ப்ஸ்? Because you are making your insulin to sleep. Only when your insulin sleeps, your lipid mobilizes. Whenever insulin sleeps, then only your lipid mobilizes. Then only you can reduce your weight. So that only happened. And she was in normal BMI before that. In order to motivate me, she was doing OMAD, that is lunch to lunch, at least once or twice in a week. And she lost 8 kgs in order to motivate me. And she is feeling healthier now. And this, and another motivator, my previous photos. And this photo has been taken by my girl with some trick. I suppose I was never like that. Even my patients used to say, "Sir, நீங்க இந்த மாதிரி உங்களை பார்த்ததே இல்லையே, எப்படி இந்த மாதிரி?" She took in such an angle. It showed very bad face of mine. And this, whenever I want to eat anything, I will take this photo and see. That's okay. Full. So I will finish off with the HealthCon lifestyle regimen by Dr. Sam. It's a simple, scientific, effortless lifestyle to prevent the healthy lifestyle diseases. He has done a study among the closed group almost for 1.5 years, and they reduced their weight with the HealthCon lifestyle regimen. And for those who are feeling it difficult to follow intermittent fasting 18 hours, you can go with that regimen. And 3 meals a day. Just to open your mouth for eating only 2 or 3 times. Not more than 3 times. Not more than 3 times any calorie intake into your body. So whatever time you take, it depends on your practice. You tailor-made, but not open your mouth for taking any food more than 3 times. No sugar, milk, rice, maida, processed food, and company foods. So we should stand against all these mafias, processed foods and company goods mafia. So you pediatricians, many pediatricians are there. So definitely you should stand against those people who are selling baby foods. And eat more protein, up to 100 grams per day. So eat more fibers, moderate amount of carbohydrate and fat. And limited cooking oil, just 20 ml per day per person for a family, and limited salt, 5 gram per day. If you take little, definitely this will come to 5 gram per day. And if you avoid company goods, again, definitely it will come down. So 1 hour simple exercise. Okay. So you are not going to participate in, you need not to have 6 packs, already married. Even girl is in 10th standard. So that and all not needed. I want to say, I never visited gym during this period. So still I was able to reduce, and still I was able to exercise, still I was able to jog in a better way. And a simple exercise in 100 to 140, and core strengthening exercise like planks, push-ups. What we did to our player, Topo Karna, that 25 times, that is enough. That has been done excellently by people of previous generation, which we missed. So just switch on to the basics. So once a week, dinner to dinner fasting, and vitamin supplements. See, this I always recommend for my patients who want to go for intermittent fasting or this health con lifestyle regimen, because we may not know what type of calories they are taking. My calories, my way of eating, I can know, but for others, I can't know. So, need not to take a costly 30 rupees, 40 rupees medicines. A simple Zincovit or stamina OD is sufficient. Okay. And just correct your vitamin D level, and sleep at least 7 hours a day. And I am here to accept, I was not sleeping 7 hours a day except for Sunday. I was not doing that. And attention tracking awareness augmentation, like you spend 45 minutes for your exercise, just spend 15 minutes for your inner self. That plays a major role. This is a simple technique that has been taught to me by Dr. Ram. Attention tracking awareness augmentation. Just sit quiet. One day, just follow your sensations. Other day, follow your thoughts. Okay, it will go. We always wonder about our past. We will always wonder our future, and we leave the present. So if you do this continuously for 15 minutes, definitely you will have control on yourself. Controlling yourself is very much important, in having a positive vibration around you. And social get together for health purpose and wealth purpose, trekking or running. Okay. And definitely from my side, by being a physician, okay, our culture and our things is not for alcohol. So say no to cocktail party, though opinion may differ, but I want to go no to alcohol. Okay. No to alcohol, cigarettes, or any type of these things. So this exclusions, pregnancy and lactation, children below 18 years, athletes and bodybuilding, diabetic patients on OHS. We are doing study in a closed group of doctors with the patients who are diabetic patients on OHA. Once that study is out, we will recommend this. But I am recommending now itself, you can go with this regimen of 3 times a meal. Open your mouth only for 3 times. That holds good for diabetics also. So you should not open your mouth now and then. Only when your sugar goes down, if you are in the impending hypoglycemia, then only you should open your mouth. Otherwise, you should not. So that can be done by the diabetic patients. And thin persons like Gunasingh sir, who are less than 18 years. 18 BMI, sorry. 18 years, sir. Your metabolic age will be like that only, sir. Have you checked, sir? Definitely it will be less. Okay. So, guidance and motivation, Gunasingh sir, Dr. Ram, and HealthCon Tamil Nadu. So, my goal is to achieve 65 kilograms before December 31st, 2023. Definitely, I will be able to do that. So, when when my friend gave this watch, has been given by my friend some almost 1 year back. I least bothered to keep it. So, smartwatch. So, once I want to do the fasting and weight reduction, I took this watch. Somehow it's synchronized with iPhone. This is Huawei watch, and it is giving excellent about your stress levels, your weight. When I set the goal for the first time, it said you can't set it. It is not allowing me to set. It is telling you can't reduce your weight before November 2024. It ridiculed me. No. Before my birthday in February, I want to reduce my weight. I am trying. It is switching to other date. So it was doing that continuously. But after 40 days, when I entered my real weight, 78.5, then it gave me a warning. You are reducing at rapid speed. Slow down, like that. Then it allowed me to come to February, and now it is allowing me to go for December itself. Okay, so all has to be said by us. Okay, so if you feel you are healthy, you are accessible to all lab parameters, lab test, you can do your test and you can live healthy. Okay, as I have motivation from my previous photo, everyone can have their motivation and have their goal setting and live a happy life with intermittent fasting. Thanks, Gunasingh sir, for